So I just want to make sure that you understand the pathology report. Even though that had characteristics that made us worry about it. Here is normal. It's a continuum. Then there's an area of what's called dysplasia, and then there's malignancy. So normal cells are very organized. Their nucleus is right in the middle. They look like little stepping stones, and they're all uniform, and there's no disorganization. Malignancy is dividing so fast, it's usually very disorganized. The nucleus is not in the middle of a cell, except in a couple of these, but usually it's very disorganized, and the nuclear material is characteristic for fast dividing cells that are malignant. But in between normal and malignancy, there's a large span of something called dysplasia. Dysplasia means it's just starting to change. And there's 3 categories of that. There's mild, moderate, and severe. Severe is approaching malignancy, and so we want a bigger margin around something like that. Moderate, we want at least a 0.5 centimeter margin around that. And mild, we want a margin around that. So we wait for the pathologist to tell us that the margin is completely free and there's no abnormal cells near the margin.
And where was mine?
Yours was moderate.
Ooh.
Okay, and we have an adequate margin. But what's important is severe doesn't always turn into malignancy. About 6% of disorganized dysplasia can turn into malignancy, but we don't know what 6% that is, so we want a dragnet to catch anything that could potentially be heading toward malignancy, put it in a bottle, and get rid of it.
Perfect.